and welcome to yet another episode of the Wellness Wave, a podcast series on health and well-being, organized by the Department of Media Science, the Heritage Academy, Kolkata. Today we have on board Dr. Suchismita Das, a consultant dental surgeon associated with the White Zone Dental Clinics. Welcome, ma'am.
Thank you so much.
We are very honored to have you on board today.
My pleasure.
So, to begin with, I would ask you that we as teenagers, we are very invested into having junk food and carbonated beverages, and which I'm sure affects our dental health. So, what would be your suggestion? Like, how can we minimize the bad effects it has on our teeth?
Right. So see what happens, the basic science is when you eat junk food and stuff, the pH of the saliva, it goes down, and that is when you have an acidic environment in the mouth, which is a thriving condition for bacteria in the mouth. So what I personally suggest my patients is that, see, when you're outside, you're having food with your friends and all, you don't have access to a wash basin where you can go and nicely rinse your mouth. So what you do is, after everything that once you finish eating, basically, you're about to drink some water, right? Just swish it around your mouth. Okay, that will help cleanse your teeth, plus it will lower or neutralize the pH of your mouth, so which will lead to less cavities.
Okay, ma'am. Ma'am, moving on, another very big issue that all of us face, especially the teenagers, is wisdom teeth.
Right.
So that becomes like a main concern. It causes a lot of pain and discomfort.
True.
So what are the precautions that we can take for that, as well as is there any treatment available related to wisdom teeth?
Right. So see, wisdom teeth, they start erupting at about the age of 17 to 18, and it goes up to 24, 25. Okay. So what happens during this time is, if your teeth are going to erupt straight, then you don't have any issues. It's your normal eruption pain, which as kids you have already faced, because a lot of teeth have fallen and new teeth have come into place. So you already know what can happen. In that case, just plain paracetamol helps with that mild pain. But in case the tooth isn't coming out upright, or it's coming in a different direction, in that case is where you start experiencing pain. So the right thing to do would be visit your dentist, because the dentist would need to take an x-ray and check what is the direction of the tooth. Okay, so if it's going to come out straight, you're all fine. If it's not, then we need to go ahead with procedures. Now, what can be done? Usually, wisdom teeth is it's a vestigial organ, like you have your appendix. It's of no use, right? So you don't need to get it removed immediately, but initially what can happen is the doctor will put you on some medications which will take control of the pain.
Okay, ma'am. Ma'am, this brings me to the question that many of us, we have deformed teeth settings.
Yes.
So can you brief us on the different orthodontic treatments that are available, and how do they differ in terms of effectiveness, or maybe comfort, or aesthetics for that matter?
Right. So see, again, we get our permanent teeth by the age of, it starts erupting at the age of 6. By the time you're 16, 17, you have your complete set of teeth that you're going to last with the rest of your life. Okay. So in that case, what happens is, when you see deformity, it's always best to get it corrected. Now, when we say orthodontic treatment, it's mostly braces. You would have seen like those steel wires and all. So that is a form of treatment which is usually used. But now with latest developments, you must have also seen on social media, you come across things like aligners. Okay, so those are also some things which can be used. Now, I would always suggest, because youngsters are into social media nowadays, and you come across a lot of advertisements for aligners. I would always recommend visit your dentist, get an expert opinion. Do not go for these DIY things which are available online, because they're going to mess up your bite. Okay, an orthodontic treatment should be done. If it's required, it must be done. It is not only for the looks. It's not for the aesthetics that you look well, you smile well. It's also for the function. And it also helps to maintain your oral hygiene.
Okay, ma'am. Ma'am, next, moving on, we do face a lot of concerns regarding mouth ulcers, which is again like we are prescribed to use some gel or something, which maybe to some extent gives us some relief at that point of time, but like in the long run, we face the same issues coming back again and again. So what would be your suggestion? What precautions should we take?
Okay, so see, ulcers, there could be different kinds of ulcers. Now, first, you need to find out what is the cause of your ulcer. So, let's say you have an accidental ulcer because you were getting up early in the morning and then you're rushing to college and you don't have enough time, and then your toothbrush hits somewhere and then you have an ulcer. Then you could also have a cheek bite or a tongue bite and end up with an ulcer. Those ulcers heal fine, but then because of stress, you can have repeated after ulcers. Okay, which also is because of vitamin deficiencies, specifically vitamin B
Yes.
and iron deficiency. That is what causes ulcers. So in case you want to prevent ulcers, you should have a balanced diet. If required, get your vitamin B levels tested. If required, go on supplements. That's always nice. Okay, and you can have vitamin B12 rich food, not just B12. It's a culmination of all. It's all the vitamin B complex. It's basically a B complex which you need to have. So just vitamin rich food and proper oral hygiene plays a very important role in this again. Okay.
Okay, ma'am. Ma'am, again, there is like a very famous myth that mouth washers they kill both the bad as well as the good bacteria. So, how often should we use a mouthwash? Or like, should we use them at all?
Okay. Yeah. So see, this has been a very controversial topic. There are loads of studies going on.
Yeah.
Okay. So American Dental Association has cleared and said that mouthwash does not kill the good bacteria because the contact time is very less. Okay. That also means that maybe it's also not killing the bad bacteria, right?
Right.
So mouthwash, see, I personally don't prescribe mouthwash to my patients. That's only a feel good factor. It gives you good breath for some time. You can definitely use it. Okay, but over a prolonged use, and if you're not using it right, which is a dilution of 1:1, that means 1 cup of mouthwash with 1 cup of water. If you're not using it right, you could lead to discoloration of teeth. So until and unless you absolutely need it, don't really have to go for it.
Okay, ma'am. Ma'am, that brings me to the question that a lot of us we face the issue of sensitive teeth. It causes a lot of pain and sudden discomfort whenever we eat something or maybe drink something hot or cold if
Right.
the temperature is differing in that sense. So, how do we deal with sensitive teeth? What are the basic precautions that we should take in order to not deal with sensitivity?
Right. So what happens when your teeth become sensitive? Why do your teeth become sensitive? The white layer which you see on your teeth, the white teeth is all enamel. The outermost layer is enamel. Wherever you have wear out of the enamel, that is when it can lead to sensitivity. Now, what can we do to prevent this? So basically, you have to preserve your enamel as much as possible. So you can have sensitivity in case you have cavities. There's a breach of enamel and that leads to sensitivity. In that case, you need to get them filled. The other causes are what kind of toothbrush are you using? Okay, never go for a hard bristle toothbrush. Try to go for a soft toothbrush, a soft bristle toothbrush. If not a soft, go for a medium bristle toothbrush. What kind of toothpaste are you using? Okay, use a very gentle toothpaste which has less particle size. You wouldn't understand a particle size just by looking at the toothpaste, right? Don't go for Ayurvedic stuff and all.
Okay, ma'am, does Sensodyne really help? Like it's so popular
Yes,
in the
yes,
market.
yes. You must have seen a lot of ads all the
Yes.
time, and it's a very good toothpaste, no doubt in it.
Okay.
But for youngsters, I would not really suggest. Okay, if you have sensitivity issues, go for it for some time. Use it for a month or two, then get back to your regular toothpaste. You don't really have to continue with Sensodyne.
Okay, so like it's not like a permanent problem.
No, no, no.
Okay.
Once it subsides, go back to your regular toothbrush. Do not brush for more than 2 minutes. If you are brushing for more than 2 minutes, you yourself are causing sensitivity.
Okay. Ma'am, also along with morning brushing, how important is brushing at night?
Brushing at night is very, very important. So you clean
Why
everything
so?
in the morning. So what happens is, like I said, whatever you're eating, there are a lot of bacteria in your mouth, right? You're basically giving them also food. Not only to your body, you're also giving them food. Now, overnight, what happens is, let's say you have eaten a chocolate last thing at night. Okay, you're watching something, you had a chocolate. Now the chocolate is stuck in your mouth. And the bacteria, they get all the time. Let's say 7 hours you sleep or 8
Right.
hours you sleep. 8 hours, the bacteria get, they have a gala time in your mouth.
Yeah.
Okay, and they produce a lot of acids.
Right.
And that in turn is going to cause cavities. It's always very important, twice a day brushing and flossing.
Okay.
and cleaning your mouth, including your tongue, the roof of your mouth, your cheeks, everything. Wherever there's a surface where you feel that food can be, stuck around, you need to clean it well.
So, ma'am, tongue cleaning is equally important.
Very
So,
important.
like, are metal tongue cleaners good?
See, metal tongue cleaners have been used
That's
for
what we
ages.
usually
Yeah,
get
yeah,
in the
yeah.
market, yeah.
So you can definitely use that. Be very gentle with it. Don't go scrubbing very hard with it, because then what happens is there's no permanent damage that can happen, but definitely, you'll have irritation, sensitivity, you'll have loss of taste and stuff like that. Use the same toothbrush which you're using to brush. Just brush your tongue with that. That's more than enough.
Okay, ma'am. Also, something that is very popular in all our household is if we face any dental issues, we do like a saltwater rinse.
Right.
Is it beneficial? Does it help in any way?
Yes, yes. See, you just asked me what about mouthwash? Should we use mouthwash?
Yes.
I would suggest why mouthwash? Use saline rinse.
Okay.
Just take a little water, put a pinch of salt in it, and rinse. What is salt doing? It has antibacterial property. Second thing is it causes osmosis, right?
Okay.
So
Ma'am,
what
can you explain osmosis?
Osmosis is when you have normal water and when you have acidic water, and the bacteria has water in it, the water content. So whenever you place salt next to it or salt water next to it, salt has a tendency to suck moisture, right?
Yeah.
When you place salt in the open, it
Yes.
sucks moisture.
Yes.
It does the same action. It sucks out the water.
Okay.
So it basically it kills bacteria.
All right.
Okay, and the same goes for when you're having, let's say, wisdom teeth. When your wisdom teeth is erupting, you have swelling, you have the swollen gums. Use lukewarm water with a pinch of salt in it. That will again reduce the swelling or that irritation which you have. So it's always beneficial. You can always use it, and that's absolutely safe to use. It doesn't cause any discoloration. It's cheap. You don't have to spend
Right.
money on it.
Yes.
So that's the best thing you can do.
Okay. Ma'am, coming to the last question, as like from the discussion, what I've understood is oral health is equally related to the well-being of the body. So can you brief on, or like, can you give like an insight on how to maintain it well?
Okay. Again, I'll be repeating the same points. Twice a day brushing.
Right.
Okay. I can't emphasize enough on it that twice a day brushing is very important. Flossing is very important. Make it a habit to floss your teeth.
Okay.
It's very, very important. It's a very good habit to have in a long run. I would say visit to your dentist every 1 year. As youngsters, maybe every 6 months, till the time you have your wisdom teeth all upright and in place. Maybe once in 6 months is very nice. After that, maybe once in a year, you should make it a practice to visit your dentist. You can't see all the surfaces of your teeth in a mirror. So the dentist, you don't have to go to a dentist to get a procedure done. You just go and see that if everything is all right. And then you come back. You have to make it a practice. Just put it in your calendar that I have to visit my dentist every 6 to 8 months.
Right.
Because oral health affects your general health.
Right.
If you don't have a good smile, if you have bad breath, psychologically it affects you
Yes.
with your peers.
Yeah.
There are other issues. Your mouth is the gateway, right? So if you're not chewing your food well, if you're unable to chew your food well because of cavities and all, you might have digestive issues. If there are a lot of bacteria in your mouth, you might have respiratory issues. You can also have cardiac issues because of it, because if the bacteria get into your bloodstream, you can have bacterial endocarditis. There are multiple things, so you just have to keep your mouth clean.
Okay, ma'am. And also, like, what about, like, what would be your suggestion when it comes to dietary choices?
Dietary choices, see, I always suggest that have a balanced diet. I wouldn't say as youngsters ki no, don't have junk, don't
Right.
have cookies, don't have chocolates, don't have ice cream. No, have everything in moderation, and make sure that you're keeping your mouth clean after that. Like I said, rinse your mouth. That's very important. Floss, brush. These are the only things that a dentist can tell you, that you have to do your part of the job. Dentists are there to help you.
Right.
But you have to take care of your teeth. That's very important, because these teeth are going to last you the rest of your life.
Yes.
You can't have another set.
Right. Very
Yeah.
true. So, all right. Thank you so much, ma'am. With that, we come to the end of the session. Thank you for joining us. Stay tuned to this channel for more updates.